Singh. Dr. Singh is a cardiologist, and he has been a practicing cardiologist since 1974.
Yes.
And you have your FRCP, am I correct? You're the author also of 2 books, and you founded the Canada Day Parade.
Yes.
We welcome you to the show, Dr. Singh. Now I begin to ask you, Dr. Singh, first of all, what is heart disease? Or is it the same as a heart attack or cardiovascular disease?
Okay. Heart disease is a big group. If you think of the heart anatomically, you can have heart disease of the lining of the heart, which is called pericarditis. You can have disease of the muscle of the heart, which is cardiomyopathy. You have disease of the inside of the lining of the heart, which is called endocarditis. And then you may have a tumor, which is called a myxoma in the middle of the heart. But the biggest part of heart disease is cardiovascular. That is the plumbing of the heart. That is the arteries that go to the heart becomes blocked. And this is one of the main causes of death and suffering among humans.
So cardiovascular is really the blockage of the
Cardiovascular, yes, it is mean the plumbing, the blocking of the arteries to the heart, which comes on from many causes. But there are also, congenital heart disease that you're born with malformations. Then you have endocrine heart disease, like somebody with thyrotoxicosis, thyroid disease may develop heart problem, palpitations and so on.
And there are different types of heart disease. You can have, I believe, a mild heart attack or a massive heart attack. Can you explain to us or
Yes, well,
enlighten
many
us?
people in the ordinary balance, they speak of a mild heart attack, meaning that they're having angina. But a heart attack actually means that there is damage to the muscle of the heart, mainly from blockage of the arteries. So you can have a mild heart attack, meaning there's a small artery that is blocked or an artery that is blocked lower down in the plumbing system, lower down in the artery. Or you can have a massive heart attack where there are 3 big branches and one big branch comes on, blocks off, and you can have a massive heart attack.
Yes.
But any heart attack is dangerous because when the heart muscle is destroyed, there arises irritability of the heart. This irritability can result in arrhythmias. The heart can go very fast, heart can stop suddenly, and that's why you have sudden death in heart disease.
Yes, I recall my mom died many years ago from at a very young age of 59.
Yes, and if you have a really massive heart attack, let's say sometimes one artery, 2 arteries are joined together just at the entrance to the aorta, and if that is blocked, you can have a massive heart attack where muscle becomes weak, and the survival in this kind of heart attack is very small.
Mm-hmm. Some survive and some,
yes.
Many don't. But would you say, Dr. Singh, that as a cardiologist, that heart disease is one of the leading causes of death?
Oh yes, it is the leading cause of death in North America and Western societies. But now as people become prosperous and they start eating too much fat and meat and ice cream and the luxurious life they get more and more. Even people from, let's say, India or China come to America and they have less heart disease there, but as soon as they come to America they start with the lifestyle, and so they get more heart disease. So it's the leading cause of death, maybe about 20 to 40% of the deaths in the United States and Canada.
You're listening to CKUT 90.3 FM. Our guest this morning is Dr. Ryan Singh. He's a cardiologist, and he's talking about heart disease, heart attacks, and how to keep our heart healthy. Now, I know you're a vegetarian yourself, And what can you tell us about diet? Would you say a vegetarian diet is better to
Yes, well,
prevent heart disease?
Yes, fat, especially saturated fat, is the main cause of the clogging of the arteries. And therefore, if you eat less fat, and if you just take a little piece of meat, put it in a glass of water, you will see how many bubbles of fat in it.
Mm-hmm.
So if you eat less meat, if you can become a vegetarian like myself, I'm 40 years vegetarian, and
you look very healthy.
I can still hit a golf ball 180 yards, and I have all my teeth. And I'm 80 years old.
Yeah, you look excellent for.
So eat less meat, and the other things to prevent is don't smoke at all. Smoke is one of the leading causes of heart disease. Alcohol in moderation may help, but if you get drunk every day, then your heart will be.
But I also learned a glass of red wine per day can be healthy.
Yes,
also
a little
helpful.
bit of alcohol, maybe glass of wine a day may help, but too much, you can have alcoholic heart disease. Then you have diabetes. If you have diabetes, your chance of heart disease is much, much increased. So if your family has heart disease, you should check about your diabetes. If you develop diabetes, you have to control it, because the diabetes, when it's not controlled, cause the small arteries to block up in the heart, in the kidneys. That's why people with diabetes have kidney failure, because of the circulation is impaired. Then you have hypertension. If you have hypertension in your family,
high blood pressure.
Yes, high blood pressure. If you get in headaches and you don't know, have your blood pressure checked regularly. But the best thing is to have a checkup with your doctor, reliable and doctor whom you have confidence in. Once a year, have a checkup, your blood pressure, your blood cholesterol, your kidney function, your hemoglobin, things like that, and the doctor give you a good checkup. Have a cardiogram at least after 25. Actually, you can have heart attack in the 20s, and they increase in the 40s, and as you go up to 60s, they increase, and 80 years old like me, 80% of the people have heart disease.
But you look excellent, Dr. Singh. What are the warning signs you can tell us to be aware of in terms of the onset of a heart attack?
Well, the most important thing is that heart attack, as I told you, cardiovascular disease, is one of the main causes of death. So chest pain is the symptom most often with blocking of the arteries. So if you get chest tightness, squeezing, pressure, heaviness, pain that goes into your arms, pain that may go into your neck, sometimes it may go into your teeth, or you may get upset stomach, vomiting. If you're feeling dizzy, if your heart jumping fast, you must, especially with chest pain, if you have chest pain like that, you should go to emergency right away and not wait and think it is indigestion. I have many cases where people think it was indigestion, actually vomiting, and it is actually heart disease. Or heart blockage of the arteries, and they're having a heart attack, or it could be just angina. Angina meaning that it is threatening. When the heart doesn't get enough blood, then it's like as if it cries, and the crying is pain. But if it blocks, then there's a heart attack, and that could be very serious, because even a small heart attack can lead to irregularities of the heart and sudden death.
So heading for the emergency is important in case you experience any of these signs or symptoms. Well, Dr. Singh, we thank you very much for joining us. And I also mentioned you are the author of 2 books. Would you like to briefly mention the name of your books and how people can contact you?
The first book I wrote was How to Make Canada the Greatest Nation of the World.
Excellent.
And that was in 1978. And it was also produced in English, in French. And I produced a new book called The Gospel of Perfection, and I'm forgot to mention there that stress. Stress comes from lust, anger, greed, harshness, ignorance, arrogance. If you can control that, you get stress. So I thank you very much, and hope that what I say is going to help you. But if you have any questions about chest pain, do not hesitate. Consult your medical doctor immediately. Thank you very much.
Or head to the emergency. And your phone number in case anyone wants to get in contact in terms of your book or your books.
Well, you can get the information at 450-671-3346. But in winter I go to Trinidad and Tobago, which is 868-665-4700.
So you're heading off to the Caribbean very soon.
Yes, in November I'll be going to the Caribbean, because when you get old like I am, your bones say go south, young man.
Well, we thank you very much. Good
Thank
luck.
you.
Appreciate you coming into the studio.
I'm sorry I couldn't come before.
That's all right, and thank you, Swansma, for helping us in this recording.